Hello and welcome to this video designed for secondary school aged children who've been invited to an initial health assessment, or IHA as we call them. The idea of this video is to help you to understand what's going to happen at the medical, to be nice and relaxed and to enjoy it as much as possible and to not worry about coming to it. To help you to realise that this isn't just yet another appointment, it's an appointment all about you and trying to help you to be the very best person that you can be. So we're going to be looking throughout the appointment for the areas where we could help you better, to help you to be happier, to help you to recover more quickly and to help you to be the very best version of you that you can be. I'm Chris Hewer, I'm a GP and I've been working with young people going into care doing these assessments for the past 10 years, and for the past 7 years I've been leading a team of doctors who've been doing them alongside me. My passion and my hope is that we can help you to recover as quickly as possible from any traumas or difficulties that you've been through recently, and to help you to thrive, to become the hero in life that you were meant to be. So why are you having this health assessment done? Well, the government says that within a month of coming into care, all young people need to have one of these done. And the idea is to find out as much as we can about you and then to draw up what I nickname as a wish list or a plan to address any issues that we find. So it might be things that are bugging you, things that you're concerned about, things that you feel aren't right, things that you're sad about, things that you're missing. If you tell us at your assessment, I can't promise, but we'll do our best to address them. It might be things that I think of, like having your eyes tested or having your teeth tested or having a sexual health review, that kind of thing. Okay, it might be something your carer mentions, say about school and trying to help you at school for things to go more smoothly. But the focus is all about you and helping you to be happy, relaxed and fulfilled. If your first language isn't English or you struggle speaking English, then you don't need to worry. We regularly work with interpreters of various different languages and they can come along to your appointment and they can help to communicate with you in your own language so you're nice and relaxed and you can express yourself fully. There are some resources on our website for unaccompanied asylum seekers with documents in various of the different common languages, including Tigrinya and Arabic, so do have a look there. Who will be at your appointment? Well, it would be great if you could be, and myself or another doctor colleague of mine will be at your appointment as well. And then it would be really great if your carer would be there. Now, sometimes carers aren't sure about coming or young people aren't sure about having their carers there, but carers provide so much helpful information. It's great having them there. And we would always make an opportunity for you to talk to us on your own without your carer there if you want to. So don't be afraid about that, but please do come along with them. Other people who may come along are your social worker, your birth parents, or possibly your siblings, brothers or sisters. It may be someone else, but the focus of the whole meeting is all around you and what's best for you. What will happen at the meeting? Well, we want to listen to you. We want to listen to how you're doing, you're feeling, how you're coping, any concerns or things that are irritating you. We want to hear all about them. We'll talk to you about how life is, how school is, how your health is, how your mental health is, and what things you enjoy doing. We'll talk about relationships, but we'll offer to talk about relationships without the carer there, and we can go into that in more detail in a moment. Then once we've done all our talking, then we'd examine you, and that would involve having a listen to your chest with one of these things, checking your blood pressure with one of these, weighing you, measuring you, maybe checking your oxygen levels with one of these things on your finger, and having a look in your ears and your throat. So nothing to worry about. We'll leave your clothes on and lift them up, but we would very rarely get someone undressed for one of these examinations. And if we do, then we'd make sure that you're fully comfortable with it and that your carer is fully comfortable with it, and we have the appropriate chaperone with us, which is just another person to check that there's nothing dodgy going on. And if you're at all uncomfortable, then we will make alternative arrangements. So please don't worry about it. Now, it is worth saying that sometimes we have to talk about some sad things and sensitive things during the medical. And if you feel emotional about what we're talking about, then please feel free to put your hand up and just tell us to stop, and we'll happily move on to the next thing. And we'll get our information another way. So please don't feel that we're going to force you to talk about loads of uncomfortable things. The other thing to say is that when we do talk about sensitive things like sexual health or substances like drugs or alcohol, then we will give you the opportunity to talk to us alone without your carer in the room, just so you feel more relaxed. And we would always have another adult in the room. So if there isn't a translator with us, then we would invite one of the chaperones to come and sit with us, who's another healthcare professional who just check that everything is straightforward and above board, and help you to feel at peace. They subscribe to all the same confidentiality rules that we do, so nothing to worry about. How long does this medical last for? Well, they last for about an hour, okay? Sometimes it's a bit quicker, sometimes it's a bit longer, but roughly an hour. And we'll make it as light-hearted and as fun as we can and as relaxed as we can, appreciating that we have to talk about some sensitive things, so I'm sorry about that. What will happen afterwards? When you've gone, we'll write up everything we've talked about into a report. A full copy will go to your GP, and then either a summary or plans will go to your carer, to your social worker, to your birth parents, to the school nurses, and to any other healthcare professionals involved. You can choose, if there's someone that you don't want to have the information, then please let us know when you sign that consent form at the start, and we can do our best to accommodate that. Sometimes we can't completely go with it, but we'll do our very best to be as flexible as we possibly can for you. Now, if you're 13 or above, then you're entitled to have a copy yourself, and we'd give you a plan. And if you're over 16 and you want a copy, then we can give you a full copy. The alternative to you having a copy yourself is to look at your carer's copy of the plan, and some children or young people aren't really that fussed at all and don't want any kind of copy themselves. So entirely up to you, but we will ask you at your medical what you'd like. I would just warn you that sometimes these reports have some sensitive information in them, so we would encourage you to have a look at them with your carer rather than on your own, but we do respect your wish and your rights in terms of seeing it. What about consent? You might be very familiar with signing forms and consent forms, and it's really important to us that you as a young person agree to have this medical done. So at the start of the medical, we'll ask you to read a section just saying that you understand why it's happening and you agree for it to take place, and to sign it to say you agree. And we will have made sure that we have all the necessarily legal consent in place beforehand as well. We will also ask you on there who you're happy for the information to go to, and we respect your decision there. But sometimes there are some situations where we have to disclose or share information, even if you don't want us to, with certain professionals for your own safety and protection. So it's purely when we're worried that you're at risk, and in those circumstances we're medically obliged to share that information. But that's quite a rare occurrence, and generally speaking we can have a dialogue about it. All right? What do you need to do before the medical? The answer is you don't need to do anything. Your carer will be filling out carer's report and possibly a questionnaire about how you're developing, but you don't need to do anything. Just come as you are, come relaxed, come up for having a chat and sharing information about yourself and coming up with a plan together of ways we can help make life better for you. Do have a think about things that might be bugging you, things that you're missing, things that are irritating you, and we'll do our best to address them. I can't make any promises. I'm really sorry, but we will do our best to, and we'll certainly flag these concerns up to the social worker. What do you need to bring to the medical? You don't need to bring anything. Just come as you are, in comfy clothes, make sure you've had enough to eat and drink, that you're comfortable, and we'll have a great time together. Finally, we realise that you've been through a lot recently. Lots and lots of changes, lots of stress possibly. I'm genuinely really sorry that you've been through all of that, but our mission, our passion, the thing that drives us out of bed in the morning is coming to help you and to try and make life better and help your future to be a really positive, awesome one. And we are so looking forward to meeting you and being able to do that with you. All the best. Bye-bye.